Okay, my name is Arya Anand. I think this is our third day, right? For our reading part A. So today you are going to do your reading part A in 10 to 12 minutes. I'm not going to take the session. It's your practice time, okay? So we'll start. Have the printed material with you.
Yes, ma'am.
Yes, ma'am.
Today I don't want to discuss the strategies. Hope you all know regarding that because this is our third day. So today's topic is inguinal hernia. Okay. So text A, they have mentioned regarding inguinal hernia. Then text B, indirect versus direct inguinal hernias. Text C, how are inguinal hernias treated? And text D, nursing intervention and post-operative interventions. Fine.
Yes,
And
ma'am.
as you all know, you have the instructions like this. You need to complete your reading part A in 15 minutes. Okay. So you have 20 questions. Hope you all remember how we practice these 2 days. For skimming, you need to take only 2 minutes time. For the first 1 to 7 question, only 1 to 2 minutes. Then next set of questions, 4 minutes. Then the next one, 4 minutes. Okay, so total 10 to 12 minutes and 3 minutes for your for checking the answers. Hope it is clear. Are you ready to do it? Check in your Telegram. We have posted the material. Okay. So you can just open that and you can do it. So reading part A, text A. Okay. Inguinal hernia is our topic. So what are the things you need to mark when you will do your reading part A?
Heading, subheading.
Yes.
Subheading, any numbers,
Okay.
Name,
Okay.
names,
sequential expression, time
Okay.
expression.
Okay. So whether we need to search for all these things or how it will be?
We have to skim.
No need.
Yeah,
Skim.
no, yes. When you will skim, if you are seeing this things, then you can mark it.
Just
Okay. So start doing skimming of text A, okay, inguinal hernia, and you can give your own headings, okay. So you have 30 seconds time to do it. Start. Done? Text B.
Yes.
Yes, yeah, text B. Indirect versus direct inguinal hernias. Okay, now text C. How are inguinal hernias treated? So you can mark headings, subheadings, okay. They have mentioned any symptoms, name of some disease or something, okay, name of the body part. You can just mark all those things. Fine, we'll move to next text, text D. Nursing interventions, post-operative interventions, they have mentioned. And under nursing intervention, they have mentioned some points. Okay, what are the things you need to administer, monitor, assess, okay. Then post-operative interventions, there also, what all the post-operative care, provide routine post-operative care, all those things they have mentioned in that, okay, under the post-operative interventions. Fine. So your time finished. Now, so what is your sequence? Focus of each text. Text A.
Definition. Type.
Okay.
Description of inter.
Text B.
Types of Inguinal.
Type.
Okay, types. Text C.
Treatment.
Treatment. Okay. Text D.
Intervention and precaution.
As in surgery, you can mention that also, no issues. Okay. Text D. Yeah, nursing interventions, post-operative interventions. So common, you can just mention interventions. Okay. So this is the sequence of this particular text. Okay. So for text A is description, text B is types, text C is treatment or surgery, whatever you are, according to your convenience, you can just give any. Text D is interventions. Okay.
Yes, ma'am.
So ready to move to questions?
Yes, ma'am. Yes, ma'am.
Okay. So 15 minutes time, answer all the questions and it must be correctly spelled. If your spelling is wrong, then you'll not get marks. Okay.
Yes, ma'am.
Okay.
What happened during surgery?
So what is your required score for reading part A?
18. 20 out of 20.
Who is that? 18.
20 out of
What's your name?
20 out of 20.
Okay. So we need 20 out of 20. Okay. Not 18, 19, 17. Okay. So ready?
Yes, ma'am.
Yes, ma'am.
Okay. So your time starts now. First question, rationale for inguinal hernia. Rationale for inguinal hernia. Second one, what happens during surgery? During surgery. Care before and after surgery. So care before and after surgery. Potential complications post-operatively. Fourth one, potential complications post-operatively. Fifth one, forms of inguinal hernia. Forms of inguinal hernia. Sixth one, recovering from inguinal hernia. Recovering. Done? Okay. So you can check your answers. First one, rationale for inguinal hernia. Reasons for inguinal hernia. Where they have mentioned? A. Okay. What happens during surgery? Surgery, where? See, treatment. Yeah, because they have mentioned regarding open hernia repair and laparoscopic surgery, right?
Yes.
Yes. Then care before and after surgery.
D.
So interventions they have mentioned in D. Yes. Then potential complications post-operatively.
Surgery.
Oh, good. Forms of inguinal hernia. Forms of inguinal hernia. Types, yes. Recovering from inguinal hernia repair. Recovering from inguinal hernia repair. D. So 6 out of 6?
Yes.
Very good.
I got 5.
Okay, 5. We'll discuss later,
5.
okay? Yeah, don't worry. We'll discuss later. Okay. Again, you have 4 minutes time to complete these questions, 7 to 14. Okay. Ready?
Yes.
After reading the question, you need to identify from which text it is. Okay. Then you need to move to that text. Then identify the answer. Okay.
Exercise.
Yes. So your time starts now. Which is the site of incision for open hernia repair? Open hernia repair. Which is the site of incision for open hernia repair?
Text C.
You can just write your answer on your printout. Okay. Then, eighth one. What medication is used to control fever caused by hernia?
D.
Okay. What medication is used to control fever caused by hernia? Done?
Done.
Okay, good. Ninth one. Which group is at the risk of developing direct inguinal hernia? Which group is at risk of developing direct inguinal hernia?
Old age.
No need to mention the answer. You can just write your answers in your booklet. Okay, print out. We'll discuss the answer later. So 10th one. Which device is used to view the internal body in laparoscopic surgery? Which device is used to view the internal body in laparoscopic surgery? Need to mention the name of the device. 11th one. What is the type of hernia repair surgery where a mesh patch is sewn over the weakened region? So what is the type of hernia repair surgery where a mesh patch is sewn over the weakened region? Type of hernia repair surgery. Those who doesn't have printout, don't worry, okay? I'll show it. Okay, 11th one, what is the type? Sorry. 12th one, which surgery needs less recovery time? Which surgery needs less recovery time? Done?
Yes. Done, ma'am.
13. Who is more prone to develop inguinal hernia? Who is more prone to develop inguinal hernia? Okay. Who is more prone to develop inguinal hernia?
Yes, ma'am. Done.
14th one. Which position is recommended to relieve crushing on the point of hernia? Which position is recommended to relieve crushing on the point of hernia? Done?
Yes.
Okay. Now one by one we will check. Which is the site of incision for open hernia repair? What is the answer?
Abdomen.
Lower abdomen.
Abdomen.
Abdomen. It's the lower abdomen.
Groin.
Groin.
They asked you for open hernia repair, which is the site of incision.
Groin.
The surgeon makes
Sorry?
a cut in the
Yes, the surgeon makes a cut in the groin. So the answer is the groin. From where you got abdomen, lower abdomen from text A?
No, ma'am. In the text C,
Oh,
the
here.
half inches insertion in the lower abdomen and insert the laparoscope.
Regarding open hernia repair, they asked the question, right?
Oh, okay, okay.
This is regarding laparoscopic hernia repair. They have
Laparoscopic.
mentioned regarding
Wonderful.
open hernia repair. So you need to
Okay, ma'am.
read the question properly. What they have asked you regarding open hernia repair, and they asked which is the site of incision. Okay. So for
Thank
open
you, ma'am.
hernia repair, the surgeon makes a cut in the groin. So the groin is the answer. Next one. What medication is used to control fever caused by hernia?
Acetaminophen.
Okay. We'll check from which text it is.
D.
Yes.
Text.
Control
Yes,
fever
text.
with acetaminophen. Okay. Spelling also you need to check, okay, whether it is correct or not. If you have spelling mistake, that answer is wrong. Okay. Clear?
Yes.
What medication is used to
Yes,
control
ma'am.
fever caused by hernia? In nursing interventions, they have mentioned control fever with acetaminophen. Then, 9th one. Which group is at the risk of developing inguinal hernia? So, sorry, developing direct inguinal hernia. So, direct inguinal hernia means which text it is indirect versus direct hernia, inguinal hernia. And here they have mentioned common in old age. And the question is, which group is at the risk of developing direct inguinal hernia? So direct inguinal hernia is there, correct? And the answer is
Yes,
old
ma'am.
age. Then next one. So which device is used to view the internal body in laparoscopic surgery? So from which text it is?
A tiny video camera.
Camera.
C. Okay. Which device is used to view? Okay. Which device is used to view?
Laparoscope.
Yes, laparoscope. See, the surgeon makes several small half-inch incision in the lower abdomen and inserts a laparoscope, a thin tube with a tiny video camera attached. Okay, so they asked you regarding the device name of a device. So which device? Then definitely it is the name of a device, right? Laparoscope. Clear?
Yes.
This even you can write from your medical knowledge, correct?
Yes.
In a laparoscopic surgery, the device uses laparoscope. But definitely you need to check and write, okay? Then next one. What is the type of hernia repair surgery where a mesh patch is seen over the weekend region? Which text it is? C, yes, surgery they have mentioned. So in treatment, usually the surgeon also reinforces the weak area in the abdominal wall with a synthetic mesh or screen to provide additional support. So which one is that?
Herniaplasty. Herniaplasty.
Herniaplasty.
What is the type of hernia repair surgery? They asked. What is the type of hernia repair surgery? Open hernia repair. Okay. Hernioplasty is what?
The name of
They
the
have
surgery.
mentioned here. Yeah, this process. This one is hernioplasty. So in which surgery? Open hernia repair. Correct. Then next one. Which surgery needs less recovery time? What's your answer?
Laparoscopic hernia repair.
Yes, laparoscopic. Which surgery needs less recovery time? Laparoscopic surgery, right?
Laparoscopic hernia.
Yes. Next one. 13th one. Who is more prone to develop inguinal hernias?
Men.
Men.
Which text?
A.
It's in the description, right? Yes. It is the common among men. It is common among men than in women. So men is the answer. Very good. Fine. Next one. Which position is recommended to relieve crushing on the point of hernia? From which text it is? Interventions, right? Care, yes. Place the patient in the Tenderberg's position to reduce pressure on the hernia site. So relieve crushing. Okay, they have mentioned here, relieve crushing on the point of hernia. Here, reduce pressure on the hernia site. The synonymous language they have used here, right? So the answer is Tenderberg's. So spelling must be correct. We'll move to next session.
Yes.
Yes, very good. So again, you'll have 4 minutes time to complete this. Okay. Ready? 15th one. Okay. So your time starts now. Again, 15th, the food that is rich in dash aids in hindering symptoms. Food that is rich in dash aids in hindering symptoms.
E, ma'am, D.
You can write your answers. We'll check it later. Sixteenth one. In order to numb the lower part of the body, a drug is injected in the spine over the dash. In order to numb the lower part of the body, a drug is injected in the spine over the dash. So when you usually try to numb the body part, think about that and find out the text, then find out the answer. Done?
Yes, ma'am.
17th one. The deformity in indirect inguinal hernia is not dash as it is in the back of fibers of the external oblique muscle. Deformity in indirect inguinal hernia. Identify the text, then find out the answer. Inguinal hernia is not dash. Done?
Yes, ma'am. Done.
Okay, 18th. The dash associated with inguinal hernia is typically exacerbated by common activities. The dash associated with inguinal hernia is typically exacerbated by common activities.
Common activity.
Done?
Yes, ma'am.
19th one. Open surgery usually requires one large incision instead of several small incisions as in dash surgery for hernia repair. So identify the text, find out the answer. Open surgery usually requires one large incision instead of small several incision as in dash surgery. So you need to find out the name of that surgery. Done? Okay, 20. In direct inguinal hernia defect, in the abdominal wall is felt on the top of the dash. Not indirect inguinal hernia, it's indirect inguinal hernia. Defect in the abdominal wall is felt on top of the dash. Finished?
Yes, ma'am.
Good.
Yes, ma'am.
Very good. I'm so happy. So we'll check the answers now. 15th one. The food that is rich in dash aids in hindering symptoms.
Fiber.
Fiber, because rich
High
in, that
fiber.
means they have mentioned regarding high. Okay. Fiber foods. Good. So I don't need to explain more, right? 16th one. In order to numb the lower part of the body, a drug is injected in the spine over the dash. In order to numb the lower part.
Waist down.
Over the nerves.
No.
Because they have
No.
mentioned here spine, everything mentioned. Okay, you need to write only nerves. Sedation with a spinal block in which a health care provider injects anesthetics according the nerves in the spine, making the body numb from the waist down. So they asked injected in the spine over the dash. So around the nerves. So answer is nerves. Then, next question, 17th one, the deformity in indirect inguinal hernia. So, which text it is?
B.
B.
Palpable.
So, the
Palpable.
deformity in yes,
Palpable.
is not,
Palpable.
yes, the deformity in indirect inguinal hernia is not palpable as it is in the back of the fibers of the external oblique muscles. Everything they have mentioned. It is the behind the fibers here, back of the synonym. Okay. Next question. The dash associated with inguinal hernia is typically exacerbated by common activities. What's your answer?
Pain.
Pain. Yes.
XTA.
Yes. Very good. The pain related to inguinal hernia worsen when coughing, exercising, or during bowel movements. Very good. No need to explain, right? Thank you. 19th one. Open surgery usually requires one large incision instead of several small incisions, as in dash surgery for hernia repair.
Herniaplasty.
Exoscopic surgery.
Laparoscopic surgery.
Herniaplasty.
Herniaplasty.
Hernioplasty. Hernioplasty where?
Herniaplasty.
No, they asked the question. Open surgery usually requires one large incision instead of several small incision, as in. That means in which surgery they will make several like small incisions. They have mentioned here the surgeon makes several small half-inch incision in the lower abdomen and insert a laparoscope, a thin tube with a tiny video camera attached. Okay, in which surgery? Laparoscopic surgery, right? Yes. Hernia repair already here. So no need to write laparoscopic hernia repair. You need to write only laparoscopic. Okay. Good. Next one. 20th one. Last one. In direct inguinal hernia, defect in the abdominal wall is felt on the top of the dash.
Pubic cervical.
Yes. Good. Finished. Today's session finished. Any doubt? Anybody knows how long you took to complete this reading part A?
I have questions.
7th answer.
Yeah, I'll show it. So, anybody knows? We took 10 minutes, 41 seconds. Now, 7th question. Which is the site of incision for open hernia repair, right? So, site of incision where they will insert. The surgeon makes a cut in the groin. So, the answer is the groin. What's your doubt in the 7th question?
Okay. I haven't seen the groin, that's why.
Oh, okay, fine. It's okay, cool.
Okay.
Any other questions?
Please, 11, question number 11.
Yeah, sure. Okay, what is the type of hernia repair surgery where a mesh patch is seen over the weakened region? Where it is? Because here they mentioned, usually the surgeon also reinforces the weak area in abdominal wall with a synthetic mesh or screen to provide additional support. Hernioplasty. So in which surgery? What is the type of hernia repair surgery? The type of hernia repair surgery, they have mentioned only two. Open hernia repair and laparoscopic hernia repair.
But the question is already is hernia repair. So answer also it will be open or open hernia repair.
You can write open hernia repair because if you write open, then the word that meaning is not complete, right? If you're writing laparoscopic, then it's complete. But when you will write open, that phrase is not complete.
Okay, clear. Thank you.
Ma'am, number 6.
Recovering from inguinal hernia repair. Recovering from inguinal hernia repair. Where recovery? Interventions they have mentioned, right? What is the meaning of nursing intervention?
Those are the treatments we are giving to management during their recovery.
Yes, nursing interventions are actions that nurses take to promote health, prevent disease, and help patients heal and recover from illness and injury.
Yeah.
Yeah, so the synonym for recovery.